you've talked about education as being a tool that empowers people, and I watched an interaction you had with an elementary school class, and it's interesting because it's 10 years ago, and you made a comment to them, and I'm quoting, "If you want to be successful in the world today, you need to know 100 different cultures and 5 languages." And you referenced there are 120 different languages spoken in Dallas County. This was 10 years ago.
Absolutely.
So think of the challenge that presents to be successful in the world.
People forget we are an international city, right? I mean, like, I got on a plane, went to Dubai, went to Bahrain, all of that from DFW. 15 hours there, 15 hours back. And as I always say, you're one plane ride from disaster too, right? Because when Ebola came here, everybody didn't understand, well, how did Ebola get here? I said, it's a plane ride away. And if you look at the guy that was infected, who was living in an apartment somewhere up near Central and Walnut Hill, he goes into the Presbyterian Hospital, and the first question I always tell emergency room physicians is, ask them if they went out of the country, because that will tell you. And then, where did you go? Look up the CDC chart. In fact, the guy that runs that for CDC, a guy named Joel Montgomery, is a friend of ours, and Joel's from the DFW area, but he runs all the deadly pathogens at CDC. And he would tell you that, yep, it's probably less than 10 hours away from any disaster. So now we know that smallpox has increased, we know monkeypox is back, and we're starting to see people infected here in the United States with that. And this is part of the global movement of people. And so, health and public health is a big consideration. I know we've got lots of anti-vax people out there, but, you look at what's going on right now. RSV cases. I just talked to several parents, their kids are in the hospital this past couple of 3 weeks for RSV exposure. Some of those parents will vaccinate their kids and some of them won't. So the question really for the parents is, do you want to leave your kids, in a bad state? So you have to make your own decision, but at the end of the day, I think, public health in that realm, especially as the population gets bigger, I think you see more exposures. And then the question is what are we going to do about it? And that gets back into, our political system. What's your vision of public health? Is it individual or is it a community-wide requirement?
And you're involved in biotechnology, working with different technologies, biologics. I mentioned to you Ray Kurzweil's book, which I think the title is "The Singularity is Near," which is the merging technology and humanity.
Absolutely.
And the subtitle to that book is "Live Long Enough to Live Forever." And you're involved in, I think, tissue regeneration
regenerative medicine is kind of the global heading for that. And I think, everybody's looking at, how can I be healthier longer, recover from injuries sooner, faster, same way with the sports guys. We've, in fact, some of the team that I work with, we're working with the NFL Players Association on CTE and using biologics. Now, the greater NFL wasn't interested in that, but the players were, because it's the players that get hurt, right? And so there's definitely success in that area. Does it need more study? Absolutely. Does it need more clinical trials? Absolutely. But is it promising? It's really promising. Yeah.
It'll extend life.
Yes.
And probably create some ethical dilemmas along the way as well.
Oh yeah. Well, I think, and this is kind of where all the ethicists will make their money, right? But I think the challenge when you ask yourself, what are we going to be able to do with lives that continue to live longer? And this goes back to the whole financial part, is most people are going to outlive their money. And so the question is so if you're going to outlive your money because at some point you can't produce money for one reason or another, physical, illness, mental, what have you, then the question is how do you build it in the front end so that you have it on the back end?
Right.
And I think that's really the challenge. I mean, and if you think about that for a second, you ask yourself, well, what's the biggest cost in the world today? Most of it's going to graduate school and college right now. And if you look at the cost of buying things, right, whether it's a house or goods or what have you. But I think the biggest challenge will be in healthcare, because long-term care is very expensive. You know, the average long-term care ticket in this town is about $12,000 a month if you pay it all out. Now, if you say, for example, you have long-term care insurance, then you're pretty lucky. And I would tell everybody, if you're thinking about it, start thinking about it at 40, buy it by 50, because by age 60 you can't afford it.
Right.
Because the premiums are so high. But if you have an elderly parent and you know you're going to do some care with that parent, you know, whether it's home care, whether it's in an institution, those costs are really significant. And so they'll eat into your savings, your investments, all of that, if you're not prepared for that. So it's something people just need to think about. And that's part of living longer.
Yep.